the menopause occurs in a woman's 40s, and into the sort of early 50s. And when a woman's in her 40s, this is the sort of peak time when you're under probably the most pressure in your life. You've often got children who are young, you've got relatives, parents who are becoming elderly, and you're reaching a peak in your career. And at this time, when you're suddenly having to take on board so much more than you probably ever had, you end up in a position where your hormone levels, which give you your energy and your drive, start to fall. So I think that it is important women recognise the symptoms early, because I think we've been very bad at actually explaining to women what the symptoms of the menopause are. Often the first symptoms are that you stop sleeping and that you start to feel low in mood or anxious, sort of feelings that you've never normally had. And as women, we're very used to, during the monthly cycle, adapting to how our body changes. We're very used to doing that anyway. And as the menopause starts, that just becomes more extreme. And so often you can sort of think, well, I just had a bad night's sleep, or I just had a bad day, or it was tough at work today. And you're not actually recognizing that very slowly everything's changing. So HRT is basically just replacing the hormones that you should have naturally. So as you said at the beginning, the average age of the menopause, the average life expectancy was around 45. And now the average age expectancy is 90. So previously it was an end of life event, whereas now it's very much something that's happening in the middle of your life. And once the estrogen starts to go, there are changes that take place in your body, and HRT basically just replaces the estrogen. I mean, if you look back historically, the first doctor who started HRT, it was in the 70s. So really before the 70s, 60s, 70s, we didn't have any HRT or hormone replacement. So throughout history, women have just had to go through the menopause. And the first clinic was actually shut down by the British Medical Association. There was a lot of controversy around it.
Gosh, that's crazy.
And then we've ended up in a position where HRT started to become more used. And then in the 80s, and 90s, there was a lot of negative press around around the use of HRT, and that it was causing cancer. And although all those studies have more or less been shown to not be true, and the risks are much, much smaller than were discussed, it really put off an entire generation of women. In menopause, your estrogen levels start to fall. And you have estrogen receptors all over your body. They're in your brain, they're all over. They're not just involved with your periods. So once the estrogen levels start to drop, you start to get atrophy in the brain, and you can actually see, so on an MRI scan, you can see the bit of your brain that controls your memory and emotion actually start to atrophy down. So when women feel like they can't cope, it's actually because the bits of the brain that control that part are actually atrophying. And you have estrogen receptors in the bladder, so you end up getting recurrent urinary tract infections. There's so many things which are affected by this drop in estrogen. So the average woman has around 7 symptoms at the time of presentation. And that can be anything from not sleeping, emotional disturbance, and that can be feeling anxious, depressed, very volatile, feeling very angry and distressed, up all the way to sort of more physical symptoms where you as I said, you get urinary tract infections, you can get tingling sensations all over your body. You can some women even get sort of asthma or shortness of breath. It can really affect all your systems.
Thinking that yesterday when you were saying that these things can go on for 10 years, and these women think they have depression and they're diagnosed with depression, and then actually it's not, it was never that in the first place.
This is the thing, the British Menopause Society, which I'm a member of, has now said that no woman in her 40s should be started on an antidepressant without a trial of HRT, that you should be thinking hormones first. They can definitely speak to their GP, but you need to speak to someone who actually has an interest in this and knows more about it. There are lots of people who are becoming more and more interested in this, but again, you need to go to a reputable source of information. At Sloane Square Medical, which I have founded, we have an interest in menopause and looking after people going through the menopause.